All right, let's say you have a rotator cuff repair or a labral repair, some sort of repair in the shoulder, and your shoulder gets super stiff. Is that a problem? Well, usually the answer is no. Believe it or not, shoulders that get stiff tend to heal better. Why? You have a more robust inflammatory and healing response. So your collagen is going to be a little better. The integrity of the tendon repairing itself to the bone is going to be better. It's not necessarily going to be faster, but what I also like, and you may not, the stiffness is also very protective because you can't do a lot with the shoulder. So people who get stiff compare themselves to others, and that's a problem. Never compare yourself in recovery because recovery is going to be yours and you're going to own this one. So if someone is not stiff and they have full motion within a week or two, that person probably has a higher risk of failure or recurrence because one, they're going to move it far too much. They're going to think that they're healed before they are. And two, they may not have had a very robust healing response. So stick with the program, stick with the process. You're going to get there, same as the other person. It's just going to take a little while longer.